Again, I'm Lennox Hoyte, MD, fellowship-trained urogynecologist, pelvic surgeon, and we're talking about bowel leakage, sometimes called bowel incontinence, sometimes fecal incontinence, which really is the unintended loss of stool, poop, if you will, in times when you're not intending to empty your bowels. It's a pretty distressing condition that can affect women, and that can really alter your quality of life and, quite frankly, cramp your style. It could be embarrassing. And so if we think about how bowel incontinence works, let's think about what measures need to happen in order to keep stool inside you when you don't want it to come out. So we all make stool, we make waste material throughout the day, and we store it in a place called the rectum. It's in the pelvis, it sits right behind the vagina, and it's a long tube that basically holds the stool in place. The outlet to that long tube is called the anus, and it has a muscle around it called the sphincter that's held pretty tightly when you want to hold the stool in. It's like a vice that holds the stool in. Other thing that helps hold the stool in is the fact that that anal sphincter is held at a really tight, sharp angle by the pelvic floor muscles, which sit around this, what's called the anorectal angle, in a way that can tighten and prevent stool from falling out accidentally. So if there's solid stool gathered in the rectum, it's not gonna leak unless the pelvic floor muscles are too loose, lax, as in due to childbirth-related injury, for example, or if the anal sphincter is too loose or lax, also related to childbirth-related injury, or sometimes trauma of other kinds. So you're not gonna leak solid stool unless there's injury to the pelvic floor muscles or the anal sphincter. And the risk factor is bigger around the pelvic floor muscles than the anal sphincter. It's thought that the pelvic floor muscles are responsible for about 2/3 of continence or retention or holding onto stool, and the anal sphincter is only responsible for 1/3. So that's solid stool. Liquid stool is a little bit different. Anytime liquid stool gets down into the near the anal sphincter, it comes out. That's just the way the bowels work. So if you have liquid stool coming down, diarrhea, digestive issues, you got celiac disease or other kinds of irritative symptoms, you got a viral disorder and so forth, and you're getting a lot of liquid stool moving down into the anal sphincter area, you're gonna leak. So leaking liquid stool tends to be, generally speaking, more of a dietary issue, and leaking solid stool, if you're leaking solid stool unintendedly, tends to be more of an anatomic issue, usually childbirth related or neurological or some kind of trauma related. Occasionally we get women, actually not occasionally, more sometimes quite often we get women who have a kind of leakage that is liquid, but it's also associated with constipation. So they end up having a solid stool stuck in the rectum. They can't get it out, and they leak liquid stool around that. And that sometimes can go along with pelvic floor dysfunction, usually prolapse, a rectocele, for example. If you think about you're having stool leakage that's unintended, the first person to check with is your primary care doctor. Make sure you don't have a viral infection or some kind of dietary issue that's leading to the stool leakage. If that's not the case and you're really clear that you're leaking solid stool, one of the first steps would be to increase your fiber intake, to bulk the stool up to make it firmer. And your primary care doc can help you with that. And if it's still at the end of the day, you're still having trouble with stool leakage, it makes sense to consult with your local fellowship-trained colorectal surgeon or urogynecologist. Sometimes specially trained urologists can do that. So here at the Pelvic Floor Institute, we're urogynecologists. We're happy to evaluate you if you have that condition, or you can consult again with your colorectal surgeon or your GI specialist, a pelvic floor physical therapist even, can help you understand if there's an anatomic component to your stool leakage. There's many tests that can be performed to evaluate source and the cause of the stool leakage. We perform many of them here at the Pelvic Floor Institute. We enable many of them. So we do see women from around the country and around the world for problems with stool and bowel control. So you're welcome to come see us at the Pelvic Floor Institute here in Tampa Bay. Or visit us at our website, www.mypfi.org. We'd be happy to help. Thank you so much for watching.
In terms of the causes of bowel incontinence, we talked previously about the fact that leakage of liquid stool usually is associated with a dietary situation, or usually an infectious situation. Certain kinds of infections of the GI tract can make the stool be liquid and lead to explosive diarrhea. One such example is Clostridium difficile, or C. diff, for example. Other ways to have leakage of stool is to actually have bouts of diarrhea, and some women have issues with something called inflammatory bowel disease, in which case they're disposed to leaking stool. The other type of stool leakage usually is associated with leakage of solid stool, usually with straining or coughing or sneezing, or sometimes unrecognized or unsensed. And that usually goes along with weakness of the stool sphincter, of the anal sphincter, which can sometimes allow stool to come out in times that are inappropriate. So it's a complex, multifactorial situation that really needs to be analyzed in detail in order to determine what the specific cause is.